Welcome to financialexpress.com. I am Tarun Bhardwaj, Senior Assistant Editor, and I am joined by Mr. Rajesh Ranjan Singh, Chief Executive Officer of the Wish Foundation. Welcome, sir.
Thank you, Tarun. Thank you for inviting me to be part of this interaction. I really appreciate it.
Rajesh Ranjan Singh, sir, has deep understanding of community development, public health, education, and livelihood issue. Wish Foundation is the flagship program of LEHS, which is working to build an equitable, innovation-led healthcare ecosystem. No conversation these days on healthcare can be complete without mentioning the pandemic. COVID-19 tested our healthcare infrastructure like never before. Even big multi-specialty hospitals were struggling to cope with its impact, and obviously primary health centers were overburdened as well. Pandemic did test our healthcare infrastructure and how. But coming to the other general situation without pandemic, my first question to you, sir, is India has a large network of primary health centers, which we call PHCs, each supposed to serve a population of, roughly around 25,000. However, the majority of the people are still struggling to access basic healthcare facilities. According to you, how can we improve this?
So thank you, Tarun. It's a very important and key questions. And as we all know that the primary health is the pyramid of any health intervention in the country, especially when you are talking about a population of 1.3 billion. The secondary and tertiary can't really take the load until you don't have a very strong primary health system. And in general, also, from our experience and a lot of other, actors, they have really opined that almost anything between 85 to 90% of the human health needs are or can be addressed at the primary health. So if you have a very strong primary health system, the pressure on the secondary and tertiary will reduce, and it will allow them to do a quality job and quality work, which they are really meant for. We all know that, like when you're talking about India as a subcontinent, and with the population, there is always pressure on each of the system, be it primary, be it the secondary, be it tertiary. The primary health center, the government of India has already initiated a major kind of program called Ayushman Bharat. And Ayushman Bharat has two components, Arun, as we all know that. One is basically that most of us are aware is more dealing with the insurance part there. The second is this whole comprehensive primary health care, which Honorable Prime Minister inaugurated two and a half years back, that we call Health and Wellness Center. And this is Health and Wellness Center is basically strengthening the primary health across 1,55,000 primary health centers in India there. The motto is that A, it needs to really have the right human resource. B, it needs to have the right infrastructure. C, it really needs to have medicine. So all medicine supply chain issues there. And also certain level of diagnostic services should be there. From the Wish perspective, Tarun, if I talk about, we define our primary health, into, a category called 4A category. We call it accessible, available, affordable, and acceptable. First thing, that your primary health within the context should be accessible to the people, right? Like people can go and travel there. People can go walk there, can paddle the cycle and reach there and access the services. Accessible doesn't really mean that services are available. So your doctor should be there. A simple example that roughly around 48 to 50% of the population, really, many of us were born in the evening. So if in a primary health center, you don't have the doctor or A&M or GNM post 5 p.m., the services are not available to. Even if it's accessible, it's not available for general population there. So make it available there, right? The third is the affordable. Now, primary health should be within the range, and the government primary health, it doesn't really charge any fees to that. In the private sector, yes, there are, but it should be affordable so that a common man, a common person or a woman can really, afford it. But within the larger public health system, the services are free of cost. So you shouldn't really have medicine being asked to patient being asked to go and purchase the medicine from outside. It should be available there. And the last one is acceptable. Even if you have all these three, but a simple behavioral of healthcare provider, how your attitudes at the workplace and while dealing with these clients from extremely rural areas, it will not make the services acceptable, honestly speaking. Right? So working on the attitude, the soft skill side of the healthcare providers is also very important. And also the quality of service. If you have a better quality of the services, people will accept it. And through word of mouth, people will start coming to you to really avail and get the access those services. So it's very important that we need to really think about all these things. Also, the point that you raise is that, so it needs to have an infrastructure. And how will these 4A will be addressed? So you need to have an appropriate infrastructure where the accessibility, people if can really access it. They need to have a sitting facility there, adequate space there. Also supply chain, as I said, that you have the doctor available, but your medicines are stock outside. So have a proper supply chain management system and make it available for the last mile there. You touched the point related to COVID. Now, do you have within the primary health system some of the screening tools? And we will, we have seen that how the India's, the startup system has really come with a lot of these screening tools, which can really be, handled at the primary health level. So some of those which are piloted, tested with clear evidence, can those be really make available in the primary health sector? Also, as I said, that 90% of the human health needs can be taken care of the primary, but so have at least those basic, primary diagnostic services available. If you have a doctor, but then you are giving a slip to the patient to go out and get tested, it's not affordable to the patient. So make those basic, essential diagnostic services available within the primary health services and centers there. And also very critical and important for any state or country to really make the primary health actually effective one is that you need to have a right data capturing system there. So you're capturing the data, and technology can also really help that in a big way. Your real-time data are being captured. It's very synchronized. One can see the whole pattern, disease pattern within the community or a family or with the patient over a period of time. And the right kind of data sets really enables the decision makers and practitioners to really intervene on the right time, take necessary steps within the stipulated time period, and improve the performance if there is any gap in that.
Well said, sir. You talked about 4 A's. One of them was availability. And then when we talk about availability, it's not just the availability of the infrastructure, but also the availability of doctors and the health staff. According to WHO, the standard doctor-patient ratio should be 1 to 1,000. However, in India, the doctors and other healthcare staffs are quite overburdened. What measures can India take in this direction?
I'll take you to the first that COVID has given an impetus on the digital. Honestly speaking, I think we need to use this momentum to the favor of making the services, available. And if you really see this, I think, telemedicine. You and I were really reluctant and hesitant. And this is talking about an educated one. People who don't have the right kind of understanding and education, their hesitancy in accepting telemedicine as an option for the general medical, kind of consultation was very low there. Right? And this is the time that we can really take advantage of the people's mindset shift. Make the telemedicine available. And I'm of the firm opinion that now telemedicine availability has increased and acceptability has increased exponentially amongst the common people there. Right? Not only for the general, kind of ailments cough, cold, fever, but also some of the specialized treatments there. People are accessing the services, and between the COVID 1, 2, and 3 wave, you saw that people were accessing services. Your general practitioners were sending you messages saying that you can access my services based on this. So use that to its fully, and not for general medicine, but also for the specialized kind of consultation you can really think about. It's very important. It's easy to say that make these services available for common people. But it's important that state and the national should make an effort. And there is a willingness, there is an effort, there is a direction in that. The government of India has actually rolled out a major telemedicine initiative under the brand called eSanjeevani. And each of the states have been really encouraged, along with the costs, right, to really go in a full speed to scale up the telemedicine services up to the last mile population there, right? Let's really take advantage of that. There are certain gaps, and there is always, when you really start in a context like India, the ambitions are there, but they need support, and they need support like having a right kind of hub where your doctors are available. So you have all the technology tool, but at the background, the doctors are not available when the patient needs them. Again, there is an issue of accessibility there, right? Like, so keep that in the mind there. I think it's also important that many of the healthcare provider itself, because they have been traditionally used to writing things on paper. Now, if you tell them to write it on a handheld device, well, there is a initial reluctance and hesitancy. And the reluctance is because of, they have not used it. So how can you really build their capacity? How can you really orient them? How can you really help them in start appreciating, acknowledging, and using these as a tool to provide the services to the people, the beneficiary population there? Technology can also address the area of capacity. If you have used now learning management platforms have been created where virtual training happens. Now, when the COVID wave 1 came in, we did thousands of trainings of healthcare providers, because every week the guidelines were changing, evolving in the country. And we wanted the patient to really know, the provider, not only patient, but the provider to know and be updated on that this week, this has changed. Next week, like, there's a new guidelines there. Also, the whole term COVID, like, the service providers, healthcare providers, doctors, even doctors were not fully, aware of that. And so this whole learning management platform, which is a digital platform, played a really huge role in building the capacity, addressing the gaps there. In fact, I wanted to also say that in some of our models, we initiated where a general medicine provider, a doctor, if he or she comes across a patient which needs a specialized, so for an skin, issues are there, he can easily connect to a dermatologist, which is specialist sitting in AIMS or any other specialist hospital. And this has been very, very successful, Tarun, honestly speaking. On certain days, you have OBGY, the gynae doctors available. So all those which have been screened through the general practitioners, they can really be directed to OBGY specialists there. And pediatric cases there during COVID, a lot of children, they had issues, even simple cough COVID, but they wanted the services. And in that case, general practitioners were hesitant and reluctant to really treat that. So it's easy to really get that. Also, in some cases, doctor-to-doctor consultation happens. So, like, if you're a doctor or I'm a doctor, general practitioner, and you're a specialist, this digital really enable me to really talk to you, discuss the case within those 5 minutes, and come back with the kind of next steps suggested by you to a general practitioner like me. And I'm sitting there facing the client. I can initially advise based on the advice that I received from you. So it's really, really, these are the steps which can take us to a next level of healthcare. And this can happen in a primary health setting. And this has been happening and will continue to really scale up based on the learnings within the country and our own learning. We're learning that. The last thing that I wanted to talk about, since you touched the issue of COVID, when the COVID wave 2 happens, right, we started talking about feeling the pain of the not enough beds in the hospital. Everyone wanted to get admitted there, even if your 2 level is a kind of manageable, still people felt that apprehension that, oh, someone has had a major issue, so why don't we get admitted? And then this home care started, right? The government came out with the guidelines there and started promoting that, oh, you don't need to rush to everything. If these are the parameters, and if you are fine on these health parameters, you don't need to go to a health facility and get admitted there. I think during that period, these telemedicines were very, very helpful. A simple example in Assam, the government of Assam came with that they were getting the names of people who were found positive and their health parameters. And very next day, they were assigning the responsibility to the doctors who were sitting in telemedicine hubs to really start connecting. In spite of the call drops, in spite of person not available with the phone or phone not charged, still around 75% of patients were reached out through these services to the telemedicine. And then they got the consults. Not only that, but mental health, issues were also addressed and continues to be addressed when people were in that mindset. What will happen to me? What will happen if my parameters are going down? And or someone a death mortality in the family or near in a vicinity. So people were going through, and this kind of platform technology has enabled us in dealing with that situation to certain extent, not fully, but yes, certain.
Okay, digital during this pandemic, the digital healthcare infrastructure did get a lot of push. Since the pandemic, the digital wave, especially in healthcare, has increased exponentially. How does the Wish Foundation utilize this trend? Share some of your experience. How did you guys utilize the digital wave, telemedicine or anything?
So the first thing, we already had an automated primary health center. We call it Digital Health and Wellness Center. We were finding it tough to convince people to access the services and reduce the load on in a physical kind of thing to move to a virtual consultation mode there. I think during COVID, right from the wave 1 to wave 3, we saw that came very, very handy there. So that's something that we did it. And so the number of consults started increasing in spite of the fact, Tarun, that there were restrictions on people moving out of the homes, right? There were lockdowns in the locality. And it's not only urban that people were accessing, but even the rural, people were accessing our services. And so this digital health and wellness center, which is actually a fully automated and digitized primary health center, really got a big push there, and it really made a difference in the health of the human lives there. That's one. Second thing, because we had a good experience on dealing with such kind of technology, a digital health, using the telemedicine as a platform, we were the first one to wherever we are present. So currently we are working in 5 states of India, and we are working in Delhi, Assam, Madhya Pradesh, Uttar Pradesh, Rajasthan, whichever state approached us first, right, asking for our technical assistance in setting up the whole telemedicine, scaling up. We were really the first one to get into. Government of Assam asked us, can you really help us in setting up the telemedicine and strengthen and we were the first one to set up the hub within the National Health Mission there. Setting up help, the government came with their healthcare providers. We brought the tools, the technologies, we build the capacity of the service provider. And we really started kind of mentoring and monitoring their work for a certain period. And then government took over from there. So setting up these kind of hubs there, doing the capacity building of those healthcare providers who were initially not very comfortable using these kind of technology. Also we use this period to reach out and provide the knowledge on COVID-related protocols and treatments to the healthcare providers. And entire spectrum from, since we are focused on primary healthcare, so most of our healthcare providers either were ANMs, GNMs, even ASHAs who are actually interfacing within the community there, and of course, medical officers. A good set of them were also lab technicians, because I think they were also equally important kind of people or position within the chain of the primary health there. We really worked and we were in a better position to address and strengthen the health system in that way to really fill the gap during the COVID and beyond that.
Okay, so the Indian government has also taken several measures. You talked about Ayushman Bharat and other things. So do you feel these schemes like Ayushman Bharat Digital Mission will enable India to achieve its goal for sustainable growth in healthcare?
Absolutely. Absolutely. In fact, Ayushman Bharat Digital Mission is something that, we all know that Honorable Prime Minister launched it on 15th of August last year there. And since then, it has really created a kind of, or I'll say that created an excitement within the system there. It also giving us an opportunity to various actors and players, be it private, be it public, be it non-profit, be it philanthropy, be it CSR, be it, right, is to really start, thinking about, talking about how to really join hands together, how to really move together to address the gap. And also the digital mission has given a good reason and architecture for us. So what are the parameters that us can really work? And that's something which is very, very critical. And that was the gap within our system there. So you have a Ayushman Bharat, you have Health and Wellness Center, but the lack of the, the policy guidance or I'll say architect was not helping us in being regulated. Now, this whole ABDM has given us a kind of clear directives about how, who, where, like when. So and this is very, very well organized. I think having said that, it will take some time, when you are not used to such kind of system there, your healthcare providers are not yet very fully informed on that. Your health seeker is not fully oriented on that. So there should be a major campaign where the provider needs to be oriented on how those digital tools and technologies can be really handled and why. And similarly, for the health seeker also, that how over a period of time, you should start looking into an alternative option, which is equally impactful and effective there. So yes, absolutely on that part. ABDM can and has come on the right time, and it's going to play a key and critical role within the larger health mandates.
True. The government has launched several healthcare schemes, but the fact of the matter is we are a huge country with humongous population, and we cannot reach everywhere. The government cannot reach everywhere. The private sector has to fill in those gaps. And during this pandemic, we saw a lot of healthcare startups coming up. A tremendous growth was seen in healthcare startups. There is also an increase in the number of healthcare unicorns in recent years. What could this mean for India?
Well, this is the time for India to be a champion in that domain, honestly speaking, and rightly so. There's a bigger opportunity because there is a big gap there, right? And I think when you have a right kind of ecosystem, so government has created that ecosystem. And when you really created an enabling ecosystem there, the private actors, the players, the other enablers started joining it. And that really also gave an impetus to the various, startups who were actually sitting in the fringe to really jump in and come out with the solution. We are full of the problems, and startups have addressed a lot of those problems and they come out with a very good solution. Government had Department of Biotechnology, as you know that, and they had already a mandate to really work in that. But beyond that, Startup India, Make in India, this whole Amrit Mahotsav,
Yes.
Private actors and players, NASSCOM, and they start also kind of added impetus to this. Many of the state government has created special economic zone for startups there, some on the pharma, some on the technology, some on the med tech. And these are actually a collective effort which created this ecosystem. And once that stronger ecosystems are there, actors and players will start getting into this domain, honestly speaking. Also, if you really see this, until few years back, the startups industry were actually labeled in few metro cities, and everyone knows about the Bangalore, Gurgaon, to a certain extent, Mumbai.
Yes.
If you see now, it has expanded beyond those metros now. It has gone to grade 2 cities, Visakhapatnam, Hyderabad, Pune, Jaipur. Everywhere you will start, Indore, you will see that the startups has started growing there. And the reason is that ecosystem is enabling at this point of time. I was just during the last budget meeting, the Honorable Finance Minister, when she really talked, she said that roughly around 44 unicorns are there in the country. But I remember that reading a paper where they said that roughly around 79 unicorns are there within the health space, and out of that, and with a total valuation of around 260 billion. In fact, in the 2021 year itself, roughly around 42 unicorns with a total valuation of roughly around 80 billions have really worked. And this happened because there is an opportunity and right environment and supportive environment and conducive, kind of ecosystem is there. And if you really see, there is a big market for that currently. It's not that, because until and unless the market is not going to be there, it's not going to be really helpful for them. You have a good solution, good product, but no taker for that. So, yeah. And also, if you see from what will happen to from the last mile perspective. So the more the competition, better the products, chances of getting a better products, right? One keeps improvising on others. So next time you'll say, oh, someone else, startup has come out with a better solution, be it digital, be it medtech, all kind of situation. And also the pricing, so competitive pricing, the products are getting over a period much more competitive from that perspective. And ultimately, and there is a bigger market, products are, pricing is right, acceptability is high, supporting system is there, investors start getting into this domain there, right? And how it really helps us, finally, those products really start impacting and affecting human lives there within their domain, if I really talk about.
You talked about healthcare products. There is a whole range of products from medicines, vaccines to healthcare equipments. While India is majorly, self-dependent on medicines and all, we have made 2 very good vaccines for COVID as well. But as far as medical equipments are concerned, we are still dependent on imports for medical equipments and devices. The recent tabled medical devices policy is also seen a crucial step in this direction. How can India become self-sufficient in this segment particularly?
I think, this draft policy, which is, many of us who are into this industry, we have really read it. And it's very aspirational in nature. It's really aspirational in nature. I think the government is saying in the next 25 years, they want to be, in a position in one of those top 5 when a country is producing these medical devices. So from a export of around exporting 80% or 84% of your product medical devices from different countries to being one of those top 5 producing medical device producing countries, that's a really very ambitious. And the good thing is that I think having a right kind of ambition with the right kind of ecosystem and supportive system, with the right set of mindset of people who are going to be part of that ecosystem, this is really very achievable. And ultimately, if you have the right kind of product there, it's going to really be effective in our one. So for an example, we have been working, Wish is known for, strengthening the whole healthcare through transforming the primary healthcare through innovation. And innovation for us have been a medtech innovation, digital innovation, and also process innovation. Right? And from the medtech perspective, since last 6 years, we have really picked a lot of those products which have been really piloted and tested in the secondary and tertiary, but never came down to the primary. And primary has the biggest market, right? Like, and we found over a period of time, not all products that we piloted, around 36 of them, are really useful or can really create an impact in the primary care. But at least 7 or 8 of them are, that's very, very, useful, effective, and impactful of that. And many of these products, over a period of time, we realized that through this proof of concept or the pilot phase, and then in helping them in either re-engineering or positioning their proper, the product in the right kind of ecosystem, it got into the public health system there. And what will happen from the commercial angle, that this is what the startup wants, right? Like, this is the growth from a startup getting into unicorn kind of status there. So it's an absolutely big, kind of opportunity. And which is in the right space. And we have a great experience that we have been using the digital technology, we have been using the med technology to strengthen the primary health system, or really make it available from those, addressing the 4A that I really talked about at the beginning of this. And ultimately, how it's going to really help, it's going to really, because if primary health is one of the key drivers to help us achieve the universal health coverage, UHC, which is our commitment to the SDG there. And until unless we won't really bring technology, we won't really bring medtech into the primary health, I think the UHC will be really not, will remain aspirational, and our SDG will get further delayed within the country context. So a combination of these three can really help us in achieving this sustainable development goal.
Coming to Wish Foundation, how does Wish Foundation cater to India's need in health innovations? How can the country achieve the health-related sustainable development goals?
As I was talking the last sentence, in fact, if you really want to achieve universal health coverage, if you want to, and it really helps, it's one of those SDG milestones. You need to have a stronger primary health. Over a 6-7 years period that Wish has been working, we developed multiple models of primary health care. And all these models were developed within the public health system. We didn't develop in a silo there. These were all developed within the public health system. When you are working within the public health system, you understand the challenges and you also learn how to navigate through the system to really make it an impactful kind of model there. Now, having been working within the public health system, it's easier for us to position those products, those models of primary health, be it digital, be it fully automated, within the larger state mandates there, because the model has been piloted to a certain extent, scale, but not fully. And the moment we start getting into this real partnership with the state and the nation, I think the scalability of the models have been really very, very, really great. For an example, we were working with Delhi government on, on this famous Mohalla clinic. So we were the overall kind of overall manager implementing partner, and we were part of a group which actually designed the whole the concept there. It's a government mandate there. Delhi government is championing this. They came out with this thought process. But when we really joined, we actually brought our own learning of what element of this clinic can be really enhanced, what needs to be strengthened, what needs to be looked into from a different angle, what needs to be tweaked there. Now, over a period, we realized first 105 clinic that we ran, we manage it quite well. And if you know this, we brought the technology angle. Initially, we piloted, electronic medical records there. But how it really helped, so you can really see a real-time number of patients, the type of patients, type of diseases, pattern of diseases within a community or a particular day or a week that, fever cases are coming more regularly in the last 3 days, or this family people, have this kind of pattern emerging this, or this community had more number of. So I think we have really brought this EMR concept within the Mohalla Clinic. Now, from a 3-tablet to from a 1-tab EMR to a complete EHR with introduction of the 3-tablet, where the pre-consult happened, during consult the doctor uses it, and post-consult all supply chain like medicines and diagnostic gets really captured there. How it's going to really help? A comprehensive data sets will be there for the patient. B, it will be efficient for each person. Otherwise, the doctor was waiting and taking time to enter and losing the time there. Now the patient got entered, doctor really look into this, and then from there it gets directed to the medicine, the pharmacist, or who really takes care of the pharma dispensation. Also, Wish Foundation has been a champion of telemedicine, and we brought all our learning during COVID, before COVID, and post-COVID to really scale up the telemedicine, be it our model or be it the government model across the state. The whole purpose was that how each nook and corner of the country really receives. And in the states that we are currently working within geography, state geography or district geography, we help the state in scaling up the telemedicine. We are also one of the initial philanthropy institution or non-profit institution who have used and brought the medtech into a primary healthcare domain there and used it fully. And now if you see this, we are very open to really share our learning. And currently with the comprehensive primary healthcare that the government has rolled out, they're actually talking about how those screening tools, technologies, and diagnostic medical devices can be really integrated into the primary health, so the patient can get the benefit then and there itself of those initial screening.
Yeah, finally, Wish Foundation has these great wellness centers across the country. What is the impact of these wellness centers? And finally, what further steps will Wish Foundation take in direction to, further increase your footprint across the country?
So in terms of our digital health and wellness center, we have been using external third party to really keep evaluating the models there. And what we really found is that over a period of time, the cost of service provision has decreased exponentially. And we were initially, when we started 4 years back, the cost per consult was coming around 1,300, because the number of patients were come, but you have the infrastructure, you have doctors cost there, and they will be there whether your patient comes or client comes or not. Over a period, we realized that it has come down to 30 rupees per patient for general and 135 per specialist consult. So we have really worked on a cost-effective digital primary health model there. The second, what we also realized is that the quality of services over a period of time has really improved, and that resulted into the higher client satisfaction. That really is one of the core indicators that we found when we were doing this evaluation, that has what has really resulted into first, are the clients satisfied there? And through a scientific approach and tool, we found that yes. And what are the parameters that, and they realized that getting the services timely, and B, they just have to really wait for 15 to 17 minutes to access these services. Whereas in other case, if you really see this, you have to really, so daily wage loss, like if you come early in the morning, within 15, 17 minutes, if you're out, you're not going to, it's not going to impact your daily wages there, right? Second, if services are close by, what's going to happen? Your out-of-pocket expenses. So we really found that most of our services, when we increase and improve the quality of services, make it available, like those 4A, out-of-pocket expenditure, which we call OOPE, of the client all went down drastically. And those are the impact, like we really found. Also, when we really were running the primary health in Rajasthan, and when we introduced these various medtech devices. So you have a portable mobile pathology lab, and which does almost 37 different kind of tests. And in a primary health care setting, roughly around 17 to 19 of the tests are more common. By introducing this, we realized that I think, the completeness and of the consults started happening, and that really resulted in the improved client satisfaction. So when you small medical device and tool, what it reduced the out of pocket. Otherwise, the patient has to go out or in the nearby CHC or district hospital to get tested, come back with the result to the PHC doctor, and then from a provisional, kind of advice to next level of advice was happening. Now, but by bringing these medtech in the vicinity, you're doing the A, efficient kind of services, B, timely, and D, correct and accurate. And these are the impact of our work over a period of time.
Okay, so with this, we have come to the end of this discussion, but this is what the work you are doing is really great, and it is bridging the gap in providing the healthcare facility to, to taking the healthcare facility to the last mile. And I congratulate you on the work you are doing, and best of luck for all your endeavors. Thank you.
Thank you, Tarun. Thank you very much. These were all deep insights, but really very practical and pragmatic points that you really raised. And thank you for giving me the opportunity to really share my perspective and our own learnings and work that we are doing in India to strengthen the primary health system.
Thanks very much.
Thank you.